day everyone, I am Kater, ang Nuligam na Gabino, your student nurse from NUST. For today's video, I will going to perform or I will going to demonstrate how to end GT feeding. Now, let's go for the assessment. First is the doctor order. Next is the client level of consciousness and level of knowledge and understanding on the NGT feeding. Availability and the functionality of the needed materials. For any clinical sign of malnutrition or dehydration. For the allergies or any food in the feeding, if the client is lactose intolerant, check the tube feeding formula, notify the primary care provider if any incompatibility exists. Now let's go for the planning. First, before commencing a tube feeding, determine the type of and amount and the frequency of feeding, the tolerance of the previous feeding. Now, let's go for the prepare the equipment. Correct type and amount of feeding solution, the 60 ml of a catheter tip syringe, emicin basin, clean gloves, pH test tip, large syringe or the calibrative plastic, measuring container for which to pour, and the feeding for using the open system, water of a 60 ml unless otherwise specific at the room temperature. Next is the feeding pump as required. Now, let's go for the implementation.
Prior to perform the feeding, introduce yourself and identify the client identity using the agency protocol. Explain to the client what are you going to do, why it is necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. Perform the hand hygiene and observe appropriate infection to control the procedure. Provide privacy for the procedure if the client desires it. Assessing the tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate to check the pH. Allow 1 hour to a plus before testing the pH if the client has received a medication. Use a pH meter rather than a pH paper if the client is receiving a continuous feeding. Follow the agency policy if the pH is equal to or greater than 6. Assess residual feeding content. If the tube is placed in the mouth, aspirate all content and measure the amount before administering the feeding. Administer the feeding before administering feeding. Check the expiration date of the feeding. Warm the feeding to the room temperature. For the rationale, unaccessed cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. For the rationale, clamping prevents air from entering the tube. Ensure the client comfort safety. Secure the tubing to the client gown. For the rationale, this minimizes pulling of tube, thus preventing discomfort and dislungment. Ask the client to remain sitting. For the evaluation, evaluate the patient response to the procedure. Document the procedure and the other important data on the client chart.